Welcome to Pennsylvania Newsmakers, and as always, thanks for watching. Well, could medical marijuana come to Pennsylvania soon? And then what about the state borrowing money already? Plus, are we going to change the names of departments in state government? But first, how about a healthcare update? Let's get to it.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Welcome back to the program. Well, we got a whole bunch of important considerations, or I should say aspects of the what's going on in the Pennsylvania Legislature. But first, one of the guys we get in here, one of our healthcare experts, he comes in and helps us understand what's going on in healthcare. Dr. Stuart Shapiro, he's the president and CEO of the Pennsylvania Healthcare Association. As always, Doctor, welcome.
Good morning, Terry.
All right, I'm not going to ask you about medical marijuana. We'll put that off. But I might have you on someday, and you'll come back at some point, and let's talk about that, the pros and the cons. You know about that. We'll do that at another time.
Interesting subject. Another day.
Another day, yeah. All right. Look, you and I have been discussing Medicaid expansion. Now we have Healthy Pennsylvania, the governor's plan. It's in effect, or it's soon to be implemented. What's good about it? What should the voters, the citizens of this state, look forward to when it comes to this program? What's going to happen with it?
Governor Corbett got it across the finish line, and he did it in a way that did not put more people on Medicaid. We have an unsustainable Medicaid system in Pennsylvania. Mm-hmm. Today, 1 in 6 Pennsylvanians are on it. If classic Medicaid expansion, 1 in 4 would have been on it. The fact is that 500,000, 600,000 poor and near poor individuals are going to have health insurance. They're going to have the same private health insurance that you have and that I have. It's here. It's going to be implemented. And whether you would have liked it done this way or that way, it's irrelevant. Yeah. It's going into effect. They're going to market it in the fall. It'll be implemented on January 1st. And no matter what political party you're in, you should say bravo and thanks to Governor Corbett for having it. It's nonpartisan.
Well, you make a good point. It's here now. Let's understand it. Basically, just go through without getting into details. It's they're going to get a subsidy. People are going to buy it on the. How's it going to work?
People are going to be able to buy insurance in the marketplace, and if they they're not employed, then it's going to be supplemented with dollars from the federal government. They're not going to get a Medicaid card.
Yeah.
They're not going to be treated as if they're in any way different than you or me when they go into the doctor and they have an insurance card.
Right.
Hospital's going to get paid. Doctors are going to get paid. And the one thing it didn't do was pit the elderly against the poor in this state, because Medicaid is unsustainable. And if classic Medicaid had been implemented, the classic Medicaid expansion, it would have drawn money away from the elderly and the disabled. And the fact is that that's the next crisis that needs addressing. And it's something we ought to talk about.
No, I do. I want to talk about that. But let me go back to another aspect of this, which I think is important. And I've had a number of folks on this program, all kind of providers, and they all say, we're providing health care services now, but we're not getting compensated for it. So invariably, virtually every interview I've done with people who provide it, they've supported, they're supporting Healthy PA. Some of them support Medicaid expansion, but the whole point is the whole healthcare delivery system was in a situation where folks weren't getting paid anything for the services. Plus, don't you build in bigger healthcare problems in the long run if people aren't getting healthcare?
Oh, absolutely. But let me address the payment issue.
Okay.
There were a lot of people that hospitals and doctors were not getting paid for.
Yeah.
They will get paid for it under Healthy PA.
Right.
They won't, but they're not going to stretch the Medicaid budget. And that's important.
I see.
They're going to get paid by private insurance companies with federal dollars rather than with scarce Medicaid dollars. But that's the problem, because when you turn to the elderly, most of them, whether they get home services or they get nursing home services, the nursing homes and the home health agencies didn't benefit from Healthy PA because didn't touch Medicaid for the elderly. And that's the crisis that we need to talk about.
Yeah. Before we go on, one quick question, then we're going to run to a break and we'll talk to you about a couple other things. I mean, my point about this was you got hundreds of thousands of people who aren't getting health care, not getting it. So they don't go and see a physician regularly. They don't get checked up. So when they do go, then, I mean, in terms of just cost, if that's all you want to look at, it's going to be far more expensive because they've not been treated for something that might have been minor that's now major. Is that a fallacy on my part?
No, I think it's mostly right. There are a lot of people who have neglected getting their high blood pressure treated. There's a lot of people who have not had their skin cancer treated. Yeah. And if you let those go, they cost a lot more. Yeah. So plus it's also the more humane thing to do to treat individuals. Absolutely. But it still doesn't address the issues of the elderly, and that's our next crisis.
Okay. All right, we'll be back. We're going to take a look at I'm going to ask Dr. Stuart Shapiro about some unfinished business, some important subjects. We'll take that up in a moment.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business.
Do.
Not me?
No. Here we're back.
This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Highway Information Association, the go-to source to learn about transportation projects and issues. Please visit pahighwayinfo.org. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
All right, we're talking about a number of healthcare subjects at the moment with Dr. Stuart Shapiro. I want to ask you another question about something, obviously, that you're intimately involved with as someone who's, runs an organization that represents healthcare associations. Lots of people go into the healthcare facilities. And another area, which is lawsuit abuse, something that's not been in the news so much lately. What's the latest that you can talk about?
Pennsylvania attracts out-of-state lawyers like flypaper attracts flies. Pennsylvania, in terms of the healthcare system, among the best in the country. Yet we're second in the country in terms of payouts or settlements. Lawyers come here, they file the same suits again and again and again, changing the name.
Right.
And providers, rather than roll the dice, settle the cases. Because especially against hospitals and nursing homes. And they're doing that because there's no protections against punitive damages.
Right.
15 years ago, there were no protections for doctors, and doctors settled 80% of the cases. There's protections for doctors against these silly punitive damages, and doctors now fight 80%, 90% of the cases. So those same kind of protections need to be extended to everyone. Hey. Those out-of-state lawyers, they come here, they advertise, they file copies of cast suits, and they do it because they know the system in Pennsylvania
there'll be a settlement,
allows them to do it.
With,
it's not fair. It's just awful.
Okay. One other thing I wanted to ask you about has to do with Veterans Day and legislation that could benefit veterans. What's the story with that?
Yeah, there's some unfinished business. The Senate and House are going to be in Pennsylvania for another
couple of weeks.
Well, I think it's 7 days of business before they go home for elections. There's a piece of legislation that passed the Senate unanimously that allows veterans who are in personal care homes or assisted living facilities to have their drugs repackaged so they can get them from the VA cheaply, and they can take them to a pharmacy and have them repackaged. At virtually no cost. Mm-hmm. And
what does that mean, repackaging?
It means that they take it from if they're in a place like a personal care home, they go to the VA and they're not tied to their beds. They go out for their normal medical care.
Sure.
But they get a bottle of 90 pills, 120 pills, just like you or I do.
Okay.
But then they're often older, they're often confused, and they need help in taking that medicine. So here they're repackaged into these blister packs.
Oh, I
so
get
it says On Monday you take this one, on Tuesday you take this one, on Wednesday you take that one. And it means they make far fewer medication errors. And that's not allowed now.
And it's common sense, right?
Oh, and it costs pennies. Veterans want it, but the law won't allow it.
So where does that stand? You say is it in the Senate or is it
passed the Senate unanimously?
So
it's sitting in the House, and we just hope it'll get across the finish line, because this will, again, as consumer advocates, we want to see those veterans benefited.
No, that's a wonderful point. I mean, I don't know how anyone could oppose that. I mean, that's just common sense. It seems like so common sense.
That is certainly our view, and we hope the House will pass it.
All right. As always, I want to thank you for coming in for the update. All right, we're going to go. Who knows what's going on in the state capitol? We have a couple of people who know what's going on. We're going to hear from them in a moment.
This broadcast of Pennsylvania Newsmakers is brought to you by Pennsylvania Credit Union Association. Pennsylvania Credit Unions, where people are worth more than money. To find a credit union that is right for you, check out ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is presented by the Hospital and Health System Association of Pennsylvania, working towards a healthy Pennsylvania, and by the Pennsylvania Coal Alliance, representing companies involved in America's most affordable, reliable energy source. To learn more, visit pacoalalliance.com.
Well, the legislature is back, and we're keeping tabs on their activities. To help us keep those tabs, Mary Wilson, Capitol reporter with the Pennsylvania Public Radio Network. I'm going to call it a network because there's so many stations that you provide reporting for. And Kate Giammarise, she's the Pittsburgh Post-Gazette Capitol reporter. All right, Kate, let me start with you. The big news seems to be, or the big debate, among other things, is medical marijuana. 24 states in the District of Columbia all have it. What's going on with that? Give us an update. Medical pot.
Well, so this is something that I would expect the Senate would pass a bill in favor of this before the end of the year. I don't know that the legislation would be able to pass the House, or that it would have the support of the governor here.
Yeah. Now, in the state right now, you've got one of the most conservative lawmakers and one of the most liberal lawmakers. Do I got that right?
Yep. Teamed up on this issue.
Mike Fulmer here. Yeah. I mean, in this market. And, I mean, looks like you're right, that the Senate looks like it, Mary, you're smiling, poised to pass, no?
I'm smiling because you called him Fike Mulmer, but yeah.
Oh, I did. Mike Fulmer. Oh, Mike Fulmer. Yeah,
no, I'm
Mike
with you.
Fulmer. Senator Fulmer. How about that?
Yeah, Senate expects to advance this in the next coming week. They said was very likely. It's got this kind of odd couple pushing the bill. Right. So a guy who came to this, Dalen Leach, the liberal Southeast senator who came to this issue because he likes the idea of recreational pot, and then you've got Mike Fulmer in the Lancaster area who says that he likes this because of Lebanon.
Lebanon, you got that.
Who became convinced about this because cannabis is being turned to as a treatment for kids with severe epilepsy.
Yeah. We had him on a program talking about it. But the House seems to be a problem. It's more conservative. There's more division. Although wasn't there a rally this past week?
There was a big rally on Monday, with a lot of parents of those children who Mary mentioned who've been really pushing for this issue. I mean, I think part of maybe why it's been sort of successful in the Senate, or will likely be successful, is it does have this sort of odd couple of people on both sides of the spectrum pushing for it.
Bipartisan support,
and
too,
I don't know that it has that kind of
support.
I don't know that there's any individuals like that in the House,
right,
that are sort of advocating for it in that same way.
But to that point, the thing that has moved very conservative lawmakers, policymakers towards supporting this issue is this heartstring part of it.
Kids.
The testimony before that, was it the state government committee or what? I mean, I watched it on PCN. I mean, it was very emotional. Yeah. And you've heard those stories, right?
Right. And there's there's also an interesting aspect to this. How do we market this toward a bunch of conservatives? How do we as Mike Verb has said in the past, how do we get rid of the, free the leaf signs and, the potheads who come to rallies like this and the guys representing normal? How do we keep them kind of on the fringes of this debate and make it a mainstream debate?
I think it's safe to say that has a fair chance. The legalization of recreational marijuana, you cover the legislature. You agree?
Yeah, I don't see that happening.
All right,
soon.
let's turn to another. The state of Pennsylvania is borrowing money already, why? To get through the budget year? They don't explain that. Go ahead. We'll let you start.
There was a lot of stories written about this week. It's borrowing money sort of from itself. It's basically other funds are loaning the general fund money, so it's not borrowing on like outside markets. But this is something that's become an issue because maybe because it's an election year, but because a lot of Democrats have said, like, hey, we said before we passed the budget, before the budget was passed at the end of June, that there was some overly rosy revenue projections. There was too many one-time gimmicks in here. The fact that this has to be done so early in the fiscal year, they're saying
caused this, and
it's validating what their concerns.
And we're in the crazy political season where anything that happens. And the other thing is, Mary, it looks like the state's moving towards a $2 billion deficit already. There's a big debate about spending, but the legislature, with a couple of weeks left, and not likely to do very much in the long run about any of this, right? You don't think there's going to be debt deficit? They're not going to deal with any likely revenue-raising devices, are they?
Oh, no.
No, short answer is no. God, not in an election campaign, right?
Right.
So does this get resolved in any way, or is it just going to happen and it's all going to go away? The borrowing money, is that just done?
Well, I think the thing to keep in mind here is that, there are two ways you can come at this issue. If you're going to borrow, it's smart to do it from yourself, so that you can do it in the cheapest way possible.
That's sort of like taking money out of my savings account and putting it in my checking account.
Yeah.
That may not be, I don't know if that's a good analogy.
Right. And you're losing what you would make in interest on your savings account.
Good point.
So you're losing that, but it's better than borrowing from Capital One or something like that. But the other thing here is that if you have to borrow at all, you're probably not managing your money in the best way possible, and that's what we're seeing here.
All right, we're going to run to a break. When we come back, we got a couple other things. The cigarette tax. I mean, the city of Philadelphia, or the school district of Philadelphia, once had $85 in $1 million. It only should be dollars. Million in revenues that they expect to get from cigarette tax. I also want to talk about a department change, a name change for a big department. We'll do that and some other things in a moment.
This broadcast of Pennsylvania Newsmakers is presented by Highmark Blue Shield, changing the way health plans work for business with a variety of plan options for employers and more choices for employees. Information is available at highmark.com. Have a greater hand in your company's health. And by the Pennsylvania Healthcare Association, the future of long-term care. This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Business Council and by the Pennsylvania Business Council Education Foundation.
Two of the state's leading reporters have joined me. We're chatting about, or are joining me, to get my tense correct, Mary Wilson and Kate Giammarise. We're talking about the legislature's back for a relatively brief session. I think they got about 2 more weeks to stay in, 6-7 session days, not a lot of time. Mary, one of the huge debates going on is over the Philadelphia cigarette tax, right? $2 a pack, 80 million, 85 million. And it looked like a done deal, and now it's not. Well, maybe a done deal. What's going on with that?
Yeah, so the line from both chambers is that, the line from the House is that it's going to get a final vote next week.
Right.
The Senate looks very likely to pass it.
It passed the Senate originally, right?
Right, but it passed the Senate with a whole bunch of goodies stuffed into it. Those goodies have been taken out by the House.
Clean vote.
Well, it's clean if you think that it's clean to add to a cigarette tax language that would make it easier to appeal a charter school rejection.
So it's not clean.
Well, it's clean. That's what it. That's how the bill passed the House
originally
in the summer.
Yeah.
Right. So you agree with her? You think it's as likely to gets through?
I think so still. I mean,
you're hedging because it's the legislature
yeah,
and you never quite know.
I never want to say it's absolutely certain, but I mean, up until this point, we have been pretty much hearing like it's expected to pass. That the leaders do agree that this is something that Philadelphia schools have said they urgently need. At the committee vote on Tuesday in the House, Mayor Nutter was there, himself, as he's been at all of these votes, the mayor lobbying in person.
I'll tell you, of all the mayors of Philly that I've known or followed, he's pretty active. He's there a lot.
See him in the Capitol a lot.
He's pretty aggressive, I think, in trying to. The other point, and if you don't want to comment about this, I'll move on. I just don't know how adding $2 a pack, how they get that $85 million. Yeah. I mean, someone joked that they want to set up a cigarette store, just literally in Montgomery County or in Delaware County or in Bucks County surrounding the city and start selling them because of how I mean, I don't smoke and never smoked, so I don't know about that. That might work, right?
Yeah, that's Steve Essex Line, reporter for the Morning Call. He's been on the program saying that that's a good line for him. And that's a common criticism. It's also common to say, why tax a product that of which people are using less and less?
Less and less because you get less revenue. All right, image. Do I have that right? A name change in one of Pennsylvania's most important and largest departments. Image. What's that about?
Well, so the House passed yesterday, and the governor is expected to sign a bill. It was passed already by the Senate that would change the name from our state's Department of Public Welfare. It would gradually become the Department of Human Services, which is something that by this point almost every other state has done. They use the term human services because it sort of better explains what the agency does.
There's also a little image going on, it's not like welfare doesn't connotate.
It does have a negative connotation, but also, I mean the vast majority of what that agency does is not cash assistance.
There you go.
Many other things.
So it makes sense what you're basically saying.
Foster care, it's adoption, it's helping seniors, it's a lot of other stuff.
All right, before I let you go, we have about a minute left. Expect the unexpected. Anything going to happen? Any of you have anything to say about something that could come out of the blue in the next 2 weeks in the legislature? Nothing.
Only thing I have to that end is that they might end the session much earlier. They might lop days off the session because there isn't that much action
yes or
so
no?
far. So
pensions.
I don't think that's likely.
Liquor.
No.
Liquor privatization.
No.
So in other words, they're all put off for a new term. Governor Corbett has said if he's reelected, he'll call a special session. Sometimes they work, sometimes, but it's interesting. They all look like they just want to go back and campaign and get out of Harrisburg. Is that basically true? Fair? Maybe I'll put it that way. Not true, but fair. All right, we'll see you next week for another edition of Pennsylvania Newsmakers, and as always, stay well.